On Health Matters right after the break.
This December, what does the future after years of living?
This week on Health Matters, we're looking at brain aneurysms. That's the name given to an abnormal bulge or ballooning in the wall of an artery in the brain.
Most brain aneurysms produce no symptoms until they become large and press on the nerves, begin to leak blood or rupture. A burst aneurysm can prove fatal. Yvonne Chan caught up with one woman who suffered a ruptured cerebral brain aneurysm.
She explained how online gaming had a huge part to play in her rehabilitation.
For avid gamers Tanya Dreyer and her husband, Austin Lay, playing World of Warcraft is an almost everyday pastime. Their son Jason usually joins in, making gaming a family affair. Looking at Tanya now, few would have guessed that just 2 years ago, she underwent a massive brain surgery. She was rushed to hospital at the end of July after suffering a brain aneurysm.
Basically, I was just talking to my husband, face to face, and I just talked, and then halfway, I just fainted.
CAT scans showed a ruptured brain aneurysm. A cerebral aneurysm is a weak spot on a blood vessel in the brain that balloons and fills with blood. It can then rupture, causing bleeding into the space around the brain. The surgeon who operated on Tanya explained why she needed immediate surgery.
She presented in a slightly drowsy condition with a ruptured brain aneurysm. And in particular, it was a rupture of the middle cerebral artery. So it was on the left side, which is the language sort of dominant part of the brain for her, the language area. So she was dysphasic and drowsy. So because she was rather drowsy, there's a potential that if we didn't treat this aneurysm, it could re-rupture and even cause her to either die or end up in a much worse condition than she already was from the first rupture.
A burst brain aneurysm can be fatal or lead to a hemorrhagic stroke, coma, or brain damage. And according to Professor Yeo, Tanya's initial condition meant her chances of recovery were high.
She wasn't the worst possible, in the worst possible state when she came in. So usually in these patients, the surgery is relatively straightforward and simple. For these aneurysms, which are quite superficial, she was what we call a good grade patient to start with. She wasn't a bad grade patient. So as expected, initially the outcome was good.
But upon returning home, Tanya found that the recovery was slow and painful.
Initially, in the very beginning, things were very difficult in the sense that, I couldn't read properly. I could read maybe like primary 1 or primary 2. And then I couldn't write properly in a sense of, even I couldn't form proper sentences. Then suddenly, I couldn't spell words. I didn't know how to structure a question. It was very emotional, and then there was a lot of pain and all that. Sometimes I would stutter, and then sometimes, when people talk, I totally cannot understand what they're talking about. And then end of the day, I'll go into panic,
She also experienced severe headaches and was easily losing balance when she moved too quickly. Her husband, seeing that she was becoming increasingly withdrawn, suggested that she get back to her gaming hobby to regain her confidence and help her recovery process.
I became very distant to everybody. I would just keep myself at home. I get depressed, and then I didn't really wanted. I have a phobia of talking to strangers. So that's where end of the day was my hubby, who actually knowing that we enjoy WoW, playing WoW a lot. So that's where he told me, say, why don't you try playing the game again. Initially I would get a few headaches whenever I try to concentrate on the game and all that. I'll actually get headaches, but slowly as I keep having the will, you know, to really change and all that. So slowly, you know, I started to type inside the game, communicate with people in the game through typing, without having to face the person directly. So slowly the phobia started to, you know, go down.
At that point, we've been playing for about 6 years already. And so, what else would be best, you know, for something that she's so comfortable doing, you know, every day. We've been playing every day, truly, you know, on top of our responsibility as parents and employees. We were both working, so yeah. So World of Warcraft was the only solution that I had that we could resort to, you know, to help her recover in that sense. But the initial part was a bit challenging. We faced a lot of challenges because since she couldn't read or write that well, and that was something that, you know, kind of like put her back to playing the game, because it's a very socializing game. I would just tell her, okay, you type this and you spell this like that. So I had to always be there to guide her in terms of spelling and grammar.
Yeah. Well, I'm new to the World of Warcraft and the world of gaming in general, and apparently there is a function within the game itself that allows a player to type and communicate with other players in the game. And according to Tanya, this capability has really encouraged her to start typing and communicating with strangers, and that has really helped in her rehabilitation process.
2 years on, Tanya attributes her near full recovery to her daily hobby. And this prompted the couple to send in her story for a contest to mark the 10th anniversary celebrations of the online game World of Warcraft earlier this year. Her story bagged the top prize, and she and Austin won a trip to attend BlizzCon, the video game convention in California. The surgeon says early diagnosis and treatment were key, but he's also not ruling out online gaming in Tanya's recovery.
It's hard to say whether it played a very sort of a definite sort of role in improving her language recovery and overall recovery, but it's certainly possible if it some way stimulates the brain. Yeah, I wouldn't be too negative or too overly skeptical that maybe it didn't have any role to play in the recovery. I think it's possible. Yeah.
Experts say brain aneurysms can happen to anyone at any time, and unfortunately, it's not something one can screen for in an annual health checkup. But there are activities that increases one's risk.
Smoking, for instance, weakens the blood vessel wall, and that could lead to formation of aneurysm and aneurysm rupture. You know. Sometimes hypertension, high blood pressure, but quite often it's none of these risk factors. So it can just occur purely for what we call hemodynamic reasons, the particular anatomy of the blood vessel. With more and more scans being done for sometimes quite minor complaints, you do pick up aneurysms in the asymptomatic stage before the rupture. So the question is, how do we treat these aneurysms or not? So there are some guidelines on when to treat these aneurysms that haven't ruptured prophylactically. Usually it relates to size, so if it's less than 7 millimeters and the configuration doesn't suggest that it would be at high risk of bleeding, then there's some evidence to suggest that we could leave them alone.
Her sudden illness has made Tanya take stock of her life and priorities. She's since quit her job at a multinational company to become a stay-at-home mom to her 4 children. While she still dreads unnecessary interaction with strangers and gets tired easily, she says she's learning to take it easy.
Sometimes when I do things, I need to take things a bit easy because I tend to get fatigued quite easily. So sometimes, you know, whenever, you know, I start to get fatigued, I get really tired, I actually have to, you know, rest, because if I don't rest, that's where a headache will definitely develop.
Much of her day is now occupied caring for her children and many pets, finishing up on household chores, and of course, her daily dose of online gaming.
Yvonne Chan there with our report for Health Matters. Now, experts have often said that word games and other activities that stimulate